So there are many questions remaining regarding in the field of HER2-low breast cancer. Specifically, I think the question of whether HER2-low is a separate biologic entity is still an open question, even though our study suggested that there were biologic differences between HER2-low and HER2-zero tumors. What is really interesting is in this entire set of studies that were done on HER2-low breast cancer during this meeting, it was split about half and half. Half of the studies found that there were some biologic differences, whereas the other half of the studies found that there were no biologic differences. And I think a lot remains to be discovered on the subject of HER2-low breast cancer. There was actually a very interesting debate between Dr. Corigliano and Dr. Sarah Tolaney yesterday, where they were debating whether HER2-low is a separate biologic entity or not. Some of the things that were brought up was that the differences that we're seeing between HER2-low and HER2-zero tumors might be driven by a difference in estrogen receptor expression, because we know that the higher the estrogen receptor expression, the more likely the tumor is going to be a HER2-low tumor. There's a lot of additional research that needs to be done to figure out if HER2-low is truly a distinct biologic entity.